Hi, it's Dr. Lewis Clark. Thank you once again for joining us on this journey, part two of dysglycemia, how to handle and naturally resolve blood sugar irregularities, meaning blood sugar that either fluctuates up and down or is commonly too high or too low. We talked about that last time. This time we're going to go into more details about how do you handle these situations and what are the mechanisms that are involved and why they occur. And I want to go back and review, first of all, and realize that there are two types of blood sugar problems and different divisions within these two main categories. Number one is the hypoglycemia. We're going to go into that in more detail. And the other is hyperglycemia, or high blood sugar, also known as insulin resistance. And then the second thing, once we identify what type of dysglycemia we have, then we must rate the severity. So that's our challenge today. We're going to get into that. So with the hypoglycemic scale of severity, the functional hypoglycemic is the one that has lost their ability to maintain their blood sugar in between meals. This is the most common type of condition that we work with. The second progression is that now they have some type of underlying metabolic imbalance. So maybe now they have adrenal fatigue, or maybe now they have some hormone imbalances or other things that are involved. And we work with a lot of clients and patients like that. The last one is due to pathological reasons, and those are the ones we do not work with. So the hyperglycemic scale of severity, there's a lot more going on here, and this is a lot more common. So first of all, they have the first phase is the person has elevated glucose after they've eaten. Okay, this is where it starts, because you're eating either too many calories or the wrong type of calories, and you lose your ability to keep your blood sugar in check after your meals. Then it progresses into insulin resistance. This is where now your insulin levels have been elevated for so long because of this that now the cell is beginning to resist insulin and not allow insulin to get the blood sugar into the cell. And then the next progression, we see a lot of these two here, and that is metabolic syndrome. This is where now not only is your insulin level high and your blood sugar high, but now your lipids, that means your triglycerides and your cholesterols, are now also going high. And then we move into the diabetic level. So diabetes starts when your blood sugar is over 126 on a glucose fasting scale, or an HA1C above 6.4. Then you get diabetes with increased advanced glycation end products. That means that now, because of the high blood sugar, you're having free radicals that are produced within your body, and you can't clear those, and now the HA1C is above 7. And by the way, in the medical realm, they don't even really worry about this, and that's unfortunate, because there's a lot of damage that's occurring when the blood sugar is at HA1C is at 7. Then we have the diabetes with destruction of tissue, and this would be things like neuropathies, whether it be peripheral neuropathies, retinal neuropathies, and even the last stage where it actually causes damage to the kidneys, and now your kidneys can't clear these things, and that's the last stage. And we don't work with a lot of clients in this stage, but we certainly work with a lot in these others. So with that said, let's look at the downward spiral of hyperglycemia, meaning your blood sugar is too high. So from a normal response, then we have that one where you can't regulate blood sugar after a meal. Then your cells become resistant. Then you get lipids involved. Then you end up with diabetes. Then you have diabetes with these free radical production causing tissue damage and complications, and ultimately ending up with kidney damage. That's the progression. That's the downward spiral. That's what happens. Timelines for insulin resistance. Really, the insulin resistance typically can go on for 10 to 15 years before you end up with type 2 diabetes. Unfortunately, this is ignored so often that it progresses without anybody even knowing that it will get to here if you don't do something. In this state, you got a lot of symptoms already showing up, things like fatigue and increased pain and depression, insomnia. These are brain-based problems that are caused because of elevated glucose and elevated insulin levels. Of course, obesity, infertility, and sexual dysfunction, as well as mood swings. Then once we get into the type 2 diabetes, we got maybe another 10 to 20 years where before we have complete, basically insulin beta cells failure to produce insulin. So hypertension is very common in this, dementia, cardiovascular disease, and stroke. But that's the timeline that we're looking at. Now, there's another side of diabetes that we must address, and this is the autoimmune side. So you can have an autoimmunity causing diabetes that's not even related necessarily to your carbohydrates in your diet. And when that happens, you can end up with type 1 insulin-dependent diabetes, or it can be a autoimmune syndrome that occurs later, and it can also be the most severe type, which we don't work a lot with these, is where you actually have an autoimmunity against your islet cells in your pancreas and their ability to produce insulin. That's the most difficult to deal with. So I want to show you that the blood sugar is related to a lot more than just your diet and your pancreas. It's related to all the other different systems and organs that we see here, including even the bacteria and the health of the bacteria in your gut, because they help you regulate blood sugar. Of course, the adrenal glands, because of cortisol and other hormones that help regulate blood sugar in between meals. Your pancreas, we know, your kidneys are involved, your brain is certainly involved in controlling any system in the body, and certainly any hormones like insulin. And then, of course, we have fat cells. And fat cells are actually considered now endocrine cells. That means that they affect hormones. And then we have the liver itself. And the liver is a big store of glycogen. We'll talk more about that later. I want to look into the physiological web of excess glucose because I want you to understand this is way more widespread than what you probably initially were taught and maybe even told by your doctor. Number one, whenever you have elevated glucose, you're going to have an increase in appetite. Leptin is going to increase, which is going to give you an increased appetite. And so now, because of that, you're also going to have insulin surges. You're going to have more fat cells. You're going to have a burden on your liver, so therefore you can't clear hormones, so your hormones are going to be affected. Then you're going to have inflammation and immune activation because of the elevated glucose levels, microglial activation, which are immune cells in the brain. Then you're also going to have intestinal permeability, which is called leaky gut. We just did a series on that. And so all these things happen just because of elevated glucose levels. It is a foundational problem that affects every part of your health. And when it gets to diabetes, it gets even more complex because now you've got a lot of joint and pain and injuries that happen easily. You got damage to neurons, which are called neuropathies. You got damage to eyes, that is a retinal neuropathy. You've got renal damage, which we've already talked about, that's your kidneys. And vascular injury, meaning that you have more risk of cardiovascular and stroke issues. And then what about hypoglycemia? Because what effect is it going to have on the body? Well, let me tell you something. Glucose is fuel to your brain. So if we don't have good blood sugar levels, we don't get fuel to the brain, we're going to have decreased brain function, decreased flow of blood to the brain, decreased perfusion, meaning poor circulation. We're going to have things like problems with our adrenal glands. We're going to have dehydration, liver problems, electrolyte imbalances. We can have hypotension, and certainly you're going to have trouble producing energy. You're going to be fatigued. Sleep is a huge problem here, okay? So when you're hypoglycemic, a lot of times you can get to sleep, but you can't stay asleep. So these are critical things that are involved here in the process of your recovery. And we're going to talk about how to address these beginning next week. I'm going to give you dietary recommendations as well as nutritional support recommendations to help you get this blood sugar stabilized. So until then, God bless and live life well.